Hello, everyone. My name is Joanne Kennedy, and I'm a naturopath in Sydney, Australia, and I specialise in methylation and histamine intolerance. Now, due to my knowledge around histamine, I have always attracted a lot of patients with mould illness, and this is because mould illness will drive histamine symptoms in a really big way. Now, mould illness is a really specialised area of clinical practice, and I am fortunate enough to work with Melanie Peers, who is a specialist in the area of mould illness, and I'm going to be interviewing Melanie today. So, hi Melanie, welcome.
Hi, thanks for having me.
You're absolutely welcome. You're absolutely welcome. So, guys, Melanie and I do work together. We share patients, and just to give you a bit of a background around how I know Mel, she was actually a patient of mine, and she presented with a lot of histamine symptoms, and we did SIBO testing, and she did SIBO low histamine diet, and she never actually really thrived doing that. And it was through that journey that she discovered that she had oxalate issues and mould illness, which is how Mel sort of started to get into mould, and now she works with me. So mould illness is something that is very, very common, and it's not really well known about. So you go to the GP, or a lot of your doctors won't actually know about it. So it's a really specialised area, which is why I've got Mel on board helping me with all the patients that come into my clinic presenting with mould illness. So Mel, what exactly is mould illness, and why is mould toxic?
Okay, so mold illness is just kind of a term that we use when people's health are significantly impacted by mold. Generally, it's not the first thing people think of, as unless they've moved into a moldy home and instantly they start to feel unwell. They normally go down the path of gut healing, all of the kind of stuff that you would normally deal with a natural room with a GP, and everything's fine. And it's because mold is driving it. The reason mold is toxic is because as part of the metabolism, mold will produce mycotoxins, and as the name suggests, they're toxic to the body. So just like any other toxin, the body has to deal with them through the liver and detoxification, but they can also be very carcinogenic, and there's particular organs that can be affected depending on which mold it is. So different mold species produce different toxins, and different toxins affect the body differently. But the kidneys, the liver, and the nervous system can often be targeted by these toxins. So that's how it's toxic. The problem with mold isn't so much about your everyday mold that you might see, out in nature. It is water damaged buildings that really are the problem that produce these toxic molds. And there's a few reasons for that. Part of it is because just the quality of builds over the years has really diminished. So we're seeing a lot of people with failed waterproofing in their homes, in bathrooms. So there's leaks happening there, because anywhere there's moisture, mold can grow. So that's the really big driver for the mold growth. So problems with builds. With all the rain we've had lately, there's a few houses on my estate being built, and I just think, oh my gosh, those timber frames have been up in the pouring rain, probably very, very moldy, and they just build the house around it. So you've got all this mold in your walls. The materials that we're using now are more mold friendly. Like, I've heard it called MCAS for mold once. It just, the mold loves what we're using in building materials these days. And we're building buildings airtight. So the government has introduced all these measures to make houses more ecological, and we're keeping the air in, but it's also keeping the moisture in. So we're not getting that good ventilation. So it's a combination of the mold's very toxic, but the environment that we're providing for it to thrive in is causing problems for people. And people who are affected by mold, there's kind of two types of people. We're not talking about mold allergy as such. We're talking about the toxicity from mold. So you have two people. We have the ones we call that are mold susceptible, and then just your everyday person who is maybe dealing with a really big buildup of mold toxins and the body's struggling. But these mold susceptible people have a glitch in their immune system that doesn't recognize the mold as a foreign invader, and it creates a lot of inflammation. So where people really struggle with mold is partially the toxicity from the toxins, but also the inflammation from the immune response, because the immune system is going crazy telling you, we have these toxins, we have these toxins. If someone's, in a home for 10, 12, 16, 18 hours a day that is mold damage, that's a lot of immune reaction that's going to be happening because you're constantly exposed. So and the people that are genetically susceptible, they're kind of the canary in the coal mine. So if you have a moldy home, they're the ones who get really, really sick and really don't thrive well in those environments. And they're the people that we tend to deal with the most. But to think if you're not mold susceptible doesn't mean it's not toxic to you either. It just means your body deals with it a little bit better.
Okay. So this chronic inflammation is driving up histamines, which is why I get a lot of these patients. Okay,
Absolutely.
So I see so many people come to me just thinking that they have histamine intolerance driven from a gut issue, where it's actually they have done SIBO testing. They might have a bit of SIBO, they've done that protocol, they're still not better. They might have a bit of candida in the gut, they've done that protocol, they're still not better. They will often come to me with a huge pile of tests that they've done. They've seen numerous specialists, and the issues are often chronic, right? And the people are never, ever really thriving. That's a classic mold person to me, is they've seen numerous practitioners, they've done so much testing, and they can never, ever find the root cause. And they are at their wit's end, they're exhausted, and they just don't respond well to normal sort of naturopathic treatments for gut health and dietary changes. So it's a really big red flag, is this people that are just never well, no matter what they actually do.
Yeah.
So,
and it's not just mold. It's like if there is anything in the environment, there are other things. Obviously, mold is our focus, and mold is a really big one. And especially with all the rain that we've had on the East Coast, it's becoming more problematic. But yes, you won't respond well to treatment. And I heard a really great phrase, which is you can't get dry while you're in the shower.
Yeah, that's very true.
And that's what's happening. You're trying to heal when you're in an environment that's making you sick. You're not removing the problem, and that's why you go to all these lengths to try and heal the gut and everything, and it just doesn't work. I often say, like, it'll touch the sides, maybe, like you get a little bit of relief, but not for the food restrictions that you have to do or the huge list of supplements that you need to take. It's not effective enough.
Yeah. So Mel, that leads me to my next question, which is, what are the signs and symptoms of mold illness?
So the main thing is it's a laundry list of symptoms. So there won't be one symptom. It's having lots of symptoms in lots of body systems. So it could basically be any symptom, because the mold can affect any system of the body. But like for neurological symptoms, for example, you have like a decreased resilience to stress, anxiety, depression, memory and cognition issues are really common. So you can't think of the word you want to use. You can't remember what you did on the weekend, things like that. Fatigue is probably one of the number one symptoms people get. They go to naturopath fatigue, and everything that should fix it doesn't. Tired no matter how much they sleep. Someone who's a bit younger, they might not have that chronic fatigue, but they might say, I just notice, like, when I work out or do exercise, I just don't recover as well as I used to. I just get more fatigued afterwards. So there's that. A lot of other neurological symptoms, but there are a few of them. The gut can be affected in a really big way. So bloating, food intolerances, SIBO, any of those digestive symptoms that don't respond to a normal gut healing protocol would be, constipation, diarrhea, any of those gut symptoms. It can affect people in the respiratory system. And the thing is, you won't necessarily have symptoms in all of these systems. People tend to have kind of one system that's a little bit more susceptible than another. So someone, it might be more gut, and other people, it might be more like asthma, wheezing. You might get nosebleeds, a cough that just won't go away, wheezing, like that hay fever allergic response. And if you're getting that in one environment over another, that's a really big red flag. If you have adult onset asthma, that is another really big red flag. So because you tend to get asthma when you're a child, and people tend to more so grow out of it rather than develop it out of nowhere. So if you have some of these symptoms and you think, wow, this all kind of started after I moved home or started a new job, it'd be worth looking at the environment. Some of the other symptoms you might get, musculoskeletal, you might find you're quite clumsy, your spatial awareness isn't there, so you're tripping over things, you're bumping into walls, dropping things. That was a really big symptom that I had. I just constantly drop things because my sense of touch wasn't really there. Muscle cramps, a decrease in your strength or even in your muscle tone, and numbness. You can get numbness in the extremities. The immune system takes a really, really big hit. So on one part, your immune function is diminished. So you might get sick all of the time. You might get a cough or a cold and it just lingers and you can't get over it. You catch everything under the sun. Or you might be someone who actually doesn't get sick, and people might think, oh, that's great, I don't get sick. But sometimes the immune system is actually so suppressed, it can't even form a symptomatic response. So it means the immune system has actually stopped responding, because when we get sick, our symptoms are simply the immune system fighting off the invader. You lose that ability. So you have a really heavy viral load. So you might get things like a lot of staph infections or, lots of little infections that just don't go away because the body just doesn't have the capacity, because it's been so overwhelmed by all of these toxins on an almost constant basis. You might get allergies, multiple chemical sensitivities, things like that. So anything to do with the immune response. So as I said, the response to a viral infection might be diminished, but then you get that other branch of the immune system that becomes hyperreactive. That's where you get a lot of the histamine type symptoms, or you might get allergies, autoimmune conditions, things like that, where the immune system's acting in a way that it shouldn't. So there's that. And then hormonal is a really big one as well. So adrenals, so if your adrenals take a really big hit, which can affect the fatigue. Weight gain can be really significant. So you might not change your diet and you might gain 10 kilos in a matter of 2 months out of nowhere, because your leptin levels are really, really significantly affected. Some people actually lose weight, and other people might not notice a huge change in their weight, but that can be a problem. And then any of the sex hormones. So for women, clearing estrogen becomes a problem. So you get a lot of premenstrual symptoms. You might have changes in libido, and for men, there can be some erectile dysfunction. So if you're having trouble obtaining or maintaining an erection, that could be a sign that your environment is having a big impact on your health.
Wow, Mel, that's a very long list of symptoms.
And there's probably 100 other symptoms I could rattle off. There's so many of them, but there are a lot of the major ones.
Yeah,
in the
it's a very systemic problem, obviously.
Mm-hmm. Yeah. So if you're someone who has a huge list of symptoms that don't seem related, it's worth looking into. And unfortunately, a lot of these people, they do get a lot of gaslighting happening, because people just think, oh, you're just depressed, you're just anxious. There's no way you can have that many symptoms. There's no way you can be that tired. You're too young. That can happen because people just don't have an understanding of what's going on.
I have had many people say to me that they don't sort of believe in mold illness, but it is very real, and we can test for it. There's tests that we can do to look. So Mel, what are those tests?
Yeah, so unfortunately there's not one test, like a blood test, that you can take and say, oh, this is your problem. So it is very much built around the symptom picture, some, looking at whether you've been exposed, but there are some tests that can give us some clinical clues. So one very cost-effective test is the visual contrast sensitivity test. That looks at your contrast vision to see whether the mold has affected the optic nerve, which can quite often happen. Because we breathe in the mold spores through the nose, it doesn't take much for it to get to the eyes and to the brain. So that's how that can easily occur. So that's about $15. And that's a really good way. You can keep taking that throughout treatment to see how recovery is going. So that's a really cost-effective test that we can use. I always do a blood test to see whether someone has that genetic susceptibility to mold, because that will direct treatment on how restrictive we need to be around mold and how we need to proceed with detoxification, because they're going to be a lot more sensitive than the average person. You can do a urinary mycotoxin test. That's pretty expensive. It's about $515. So if someone comes to me with that, that's great. I don't always order it, just because if you are one of those genetically susceptible people and your detoxification is really badly blocked up, you won't be detoxifying any of those toxins. So that's what the urinary test is looking for, your excretion of these toxins.
Right.
So it could come back negative, and someone would say you don't have a mold problem whatsoever, when in fact you've actually got a really bad mold problem because your body's not clearing any of the toxins.
Oh, I see.
So I sometimes use it if I feel it's warranted, but if I feel like somebody has really impaired detoxification, I feel like it might be a little bit of a waste of money. So if there's anyone out there thinking, I'm going to go do this test, it might be worth holding off, because you might be throwing away $500 and you'll move on to the next thing when mold actually is your problem. So that can be a little bit tricky in that regard. And then the other test is the organic acid test. There can be some markers on there that would show us mold exposure. So, but primarily it's very much about taking a thorough case history and looking at the symptoms, the exposure, and then some of the markers that we're seeing on these tests.
Okay, interesting. What about that MSA test, the melanocyte stimulating hormone?
Oh, yeah. So I do that one as well when I do the genetic susceptibility test. So that is the HLA gene, because if your MSH goes quite low, even if you're not genetically susceptible, you can develop what we call CIRS, which is chronic inflammatory response syndrome. That's a hormone that regulates the mucous membranes. And so it stops things like bacteria and viruses being able to colonize in your nasal passage. And when that becomes very low, you become very, very susceptible, and you can develop this full-blown inflammatory response. So I do both of those together.
Okay. So it is a real clinical skill to work out what testing each person needs.
Yeah, absolutely. And sometimes
people could spend like $5,000 on testing.
If somebody came to me and said, I have an unlimited budget, I would probably spend $5,000. I would do all of them, but I have to, for most people, we have to choose what we do and don't test. So there is a really big panel that you can do for about $1,000. It looks at a lot of different markers, but it's just unaffordable for a lot of people. Especially,
each person needs a different number of tests, and that's what you can help them with. Is decide where to start, because that's important. Each person requires different testing.
Yeah, that's right.
So Mel, so you were saying that mold impacts the detoxification pathway. So, I know a lot about methylation and that detoxification pathways, and does mold impact methylation? And what about the other pathways of detoxification, such as glutathione and sulfation and glucuronidation?
Yeah, so it has a really big impact on detoxification, and that's where people will often get those multiple chemical sensitivities, because the liver's so overwhelmed it's not detoxifying. So on a very basic level, there's just a huge amount of toxins coming in and the body cannot cope. So all of those pathways become overburdened. So, and the liver becomes very overburdened. So that's probably the most basic way. Methylation doesn't necessarily get impacted too much. It's not a huge pathway for detoxifying the mycotoxins, but inflammation and the nutrition deficiencies that come from being exposed to mold can impact that pathway. But that's not probably the number one pathway that we'd be looking at being affected. And obviously someone with methylation issues already has an impaired ability to detoxify, so they might be a little bit more susceptible anyway. Sulfation is a big one, so that uses sulfur, and there's a few ways that can be impaired. So first of all, you need cellular energy, which is ATP, for that pathway to work. The toxins from mold can get into the mitochondria and affect the ability of the mitochondria to produce ATP, because it can actually damage those cells. So if you don't have enough ATP because the mitochondria is damaged, you're not going to be performing sulfation very well. And sulfation is a detox pathway, but it is also another pathway in the body that activates hormones and things like that. So it's a process that's body-wide. It's not just a detox pathway. Also, the toxins can deplete the enzymes that run that. This is the thing about mold and the toxins, is not only do they create this huge toxic burden, they actually have the ability to switch off the mechanisms that our body can use to try and clear them.
Wow. Okay.
So you have a huge burden coming in, and then it's going in and switching off all of these pathways that are actually needed to clear it. Obviously great for the mold and the toxins because it's a way it can survive in the body, but not so great for us. And then with sulfation, another problem can be oxalate, which I know we're going to talk about in a little bit, because when you develop an oxalate problem, it can deplete a lot of your sulfur. Your body will be wasting the sulfur because the oxalate is pushing it out. So you lose a lot of sulfur that way. Glucuronidation is a huge pathway for detox just in general. It detoxifies a lot of the chemicals that we're exposed to in the environment and a lot of medications. So it's a really big, important pathway. And that also, it's really important for clearing mycotoxins. There's a lot of toxins that do go down that pathway. So it's a really big pathway that we need working really well. It does a lot, but it also gets overburdened because there's so much. Glucuronidation can be overburdened just by living in the modern world, because there's so many chemicals. You know, throw in some mycotoxins and then it becomes even more impaired. So that can be a problem for that. The dysbiosis that happens with mold exposure, because the gut bacteria are often displaced, can then mean that we're creating more of this enzyme called beta-glucuronidase. So this is an important enzyme that helps the body recycle estrogen, and in normal healthy levels is actually a good thing. What happens is if you have an overgrowth of the bacteria that produce those, then the level becomes pretty high, and every time something comes through that pathway and it's bound up, it gets deconjugated, and then that toxin, whether it's estrogen or a mycotoxin or anything else, then gets recirculated. So what's happening is the body is trying to clear all of these things through this pathway, and it's this enzyme is like a scissor. It's just cutting the bonds and the toxins being reabsorbed. And so that's actually increasing the burden. You're using all of these nutrients to try and get through this detox pathway for it to just go back up into the bloodstream again and has to be done again. So that's a really big one. We see that a lot. So lots of people have estrogen issues when they've been in mold because of this pathway. So that's a really, really important one. And then glutathione is a really important, so that's an antioxidant. It's also a pathway in the liver, and that is a really powerful antioxidant. So again, not as important as glucuronidation, but there are some molds that do detoxify through that pathway. And then if you think back to sulfation, if we've got sulfur being used up there, we don't have enough for that. If you don't have sulfur, you don't have glutathione. Mm-hmm. So it becomes this really, like, the issue just piles one on top of the other, and it gets worse and worse and worse because every function then inhibits the next function from happening. So you have all of these issues across multiple systems happening at once. Yeah. So huge, huge burden.
And Mel, no wonder these people are so unwell. They're really, really, really sick, these patients.
Yeah, and I think if we weren't living in the toxic soup of a world that we live in now, if we were living 500 years ago, we'd probably be able to tolerate these molds a little bit better, especially those that are not genetically susceptible. But most people walking around these days are dealing with an overburdened liver, whether they're getting symptoms or not, because we're just exposed to so many toxins that you throw this on top of it and it's just enough to wipe you out.
Yeah, I know. I see it in clinic all the time. And the gut, when the gut's out, it's gonna keep shunting toxins back to the liver to just be recycled, and mold will really throw the gut out. So it's a really vicious cycle that needs to be broken.
Yeah, absolutely.
So Mel, just so people can get an understanding about the mold and where does it actually, what are the common places that mold is going to grow in your house?
Okay, probably the most common spot would be the bathroom. Most people will say out in their shower, or the ceiling is got a little bit of mold, and that might not necessarily be a huge problem. There are certainly other ways that mold can cause more problems, but that's probably the most common. So absolutely open your windows and put your fan on when you're having a shower to reduce that. But water leaks are a really big problem. So if you've got a leaking shower, if you've got your vanity is leaking into the wall, and the most unfortunate thing about these water leaks is you might not even know they're there. So I've had one client who moved into a brand new home and there was no visible mold, and I said, you need to get someone in to have a look, and the shower was leaking. When they opened up the wall, it was full of mold, full of it. Couldn't see it, couldn't smell it, had no idea, brand new build. They didn't do the waterproofing properly. Things like a washing machine leaking, a burst water pipe moisture that's been there for more than 48 hours will encourage mold growth.
Really? Only 48 hours?
So if you've had a burst pipe and you don't clean it up completely within 2 days, then mold can start growing.
Wow.
So, that little dripping in the wall from a pipe is going to allow mold to grow.
Okay.
Yeah, behind toilets. I've got a lot of stories from a lot of clients who have had mold growing in the most unusual places because there's been water leaking into the wall that you don't even know it's there.
They can't.
Can't see it. So there are some signs that you can look for that there's water damage, like if you've got flooring and that's starting to warp a little bit, or paint's starting to peel or flake, but you might not see it. The other place that's pretty common is just like poor ventilation. So you get like condensation on your windows. So windows on the windowsills or on the fly screens that can develop, like especially if you've got a house that's like very shaded, or just as simple as in the wintertime having your heater on and it's cold outside and it's warm inside and there's that condensation. So as I said, that moisture. So that's a pretty common place. But yeah, keeping your eye out for any water leaks is really, really important.
Okay. So just going back to this oxalate issue, can you explain to everyone like what oxalates are and how mold is a driver of a lot of oxalate problems?
Yeah, sure. So oxalates are found in plant foods, and we do have a video on oxalates that people can go back and watch if they want to learn a lot more.
We do.
But they're basically these sharp crystals in plant foods that can be very damaging to the gut. We can tolerate a certain amount, but when the threshold is exceeded, our body cannot excrete them, and we might start absorbing them into the bloodstream, and you can get a whole host of symptoms. It's very common to see people with a mold issue to also have oxalate issues, but you can have a mold problem without an oxalate problem, and you can have an oxalate problem without a mold problem. But the way we see these two together is, first of all, is aspergillus, which is a type of mold, makes oxalic acid as part of its metabolism. So just by having aspergillus present means that your total body load has already increased. So your tolerance to what you're eating is diminished because you're reaching kind of that threshold of what the body can deal with. If you have sulfur depletion, sulfur is really important to kind of push oxalate out of the cells. So they share the same transporter. So when you don't have enough sulfur in the cell, the oxalate can easily get in. So that can cause a problem if you don't have enough sulfur, which, I just mentioned previously about how much sulfur gets used up to detoxify mold. So you can become sulfur depleted because of that. Just the simple, like the hyperpermeability of the gut that happens with the gut issues means more oxalate can get in through to the bloodstream from the gut. It is small enough that it can get through the tight junctions, but if you have hyperpermeability, more can get in more easily. So that can contribute. And then just nutrient deficiencies. So there are certain deficiencies that when we're like depleting B1 and B6, we don't know why, but the body starts producing more of this oxalic acid, which is oxalate. So that, a little bit like what I was talking about with the mold, means that you have a higher amount in the system. So your threshold is diminished of what you can tolerate coming in. And so when the oxalate levels are too high in the blood, they just get shunted into tissues to kind of protect the body, but you'll get things like joint pain. You might get what seems like UTIs, but it's just that these crystals trying to be excreted from the body, and they're very damaging to the gut as well if the gut can't get rid of them quickly enough.
There's a very long laundry list of symptoms of oxalate as well. So guys, if you're interested, oxalate, Melanie and I have done an interview on oxalate toxicity. It's on my YouTube channel, and you can check that out. In the text below, it lists all of the symptoms of oxalate, which are actually quite lengthy as well. And people can go undiagnosed with oxalate toxicity for decades. And
Absolutely.
It's insidious. They're sharp crystals. They deposit in joints. They deposit in your gut, in the bladder, and they cause significant inflammation and significant histamine. Like, don't they? They cause a lot of histamine symptoms.
And probably the one thing that's probably like really sad about the whole situation is that you have this mold problem that you don't know about yet, but you know, everyone that you go to see will tell you that you have a lot of oxidative stress.
Yeah.
And what do these people do? They go and start juicing and taking all of the really great antioxidant superfoods, having turmeric till the cows come home, and these are all really high in oxalates. So they're actually worsening their problem because those oxalates cause oxidative stress. So you're putting all of these antioxidants into your body that is actually worsening the problem. So if you feel worse when you eat well, look at oxalates.
If you're eating well and you do feel worse from it, you don't push through. There's something wrong. There is something wrong. There is absolutely something wrong if you're doing that.
All the influencers online will say, just push through the detox, but no, you don't want to. You're damaging your body. So yeah, if you eat well and you feel worse, look at oxalates or mold or both.
Yeah, absolutely. So oxalates are high in a lot of plant foods, nuts and seeds, sweet potato, beetroot, buckwheat, almond. So people go gluten-free and they start having lots of buckwheat breads and
or paleo.
Very paleo diets can really increase your oxalate load to a point where you can't break it down.
Yeah,
that's really
there'll be a lot of pain.
Pardon?
You get a lot of pain. That's the one thing I'll say about oxalates. It's pain.
Pain. Oxalates is pain symptoms, definitely.
Yeah.
So Mel, where do we start to treat mold illness? Where do we start?
Okay, so first and foremost is avoidance if you can, which I know is easier said than done, especially if you're living in a home that is contaminated with mold. But so if you're someone who feels terrible most of the time and then you go on holidays for 2 weeks and you start to feel better, red flag that mold is a problem or your environment is a problem. Because, and a lot of people will just say, oh, you know, I wasn't stressed or things like that. But we tend to find, don't you agree, if someone's really, really stressed, when they go on holidays, they get sick. They'll get a cold or a flu because the body finally goes, oh, great, I've got some space to deal with these. If you go away and you feel a lot better and you can eat foods that you normally couldn't eat or your energy picks up, I would be looking at mold as a potential cause. So the biggest factor in healing is avoiding the mold. And people who move out of mold will tell me within 2 weeks, my brain's working better, my energy's better. And then we just kind of deal with the fallout. Like usually the gut is a mess and we have to work on that. But a lot of things will start to correct just by being out of the mold. So first and foremost, avoiding the mold as much as you can. And people who are stuck in a home with mold while they try and figure out what they do, I just try to get them to at least clean up like maybe their bedroom to make that a safe space. So if you're spending 8 hours in your bedroom, have that be mold free, whether that means you have to replace your mattresses or move to a different room or something like that. Just at least that can take some of the burden off. So you're spending a lot of time in that. And then the next thing you need to do is opening up your drainage. So people want to jump straight to detox. Let's detox and let's, you know, but if your drainage pathways are blocked up, which often they are, then that toxicity is not going anywhere. So pooing daily, 2 to 3 times a day, if possible, is best. So if you're constipated, that toxicity is going nowhere. Yeah. So opening your bowels, getting the lymphatic system moving. So cold showers, movement, dry brushing, whatever you can tolerate, because people can be really quite unwell and unable to exercise. So if you can't exercise, just some stretching and moving and some lymphatic massage maybe really, really important. Getting the kidneys working well, getting enough fluid in. And it's not just about drinking water. Sometimes people need electrolyte support because your electrolytes can be very, very depleted. So if you are someone who drinks water and needs to run straight to the bathroom, your urine's always clear, you're always thirsty no matter how much you drink, you're probably not absorbing your fluids, and that's putting a heavy load on the kidneys. So you need to get that moving. Some people can tolerate like infrared sauna because you can sweat. That's not for everybody though. You need to do that on a case-by-case basis, and then we can start binding the toxins. Once you're emptying your bowels regularly and you've got that drainage happening, we can start using binders to bind up to those toxins so that you can pass them out through the stool.
What are the binders that you use now?
So I use a product called GI Detox, and it's actually like a multiple binding product, because we don't always know what people have been exposed to, so we just kind of take a blanket approach and we try and bind up. But things like bentonite clay, charcoal are really, really good. They cover most of them, so people can maybe start on that, and then we can review from there what we need to do with specific binders. But even just like fiber, having enough fiber in your diet is really important for binding up toxins. Making sure your bile flow is happening, that's another part of the drainage pathway. If your bile flow, like the body's literally dumping toxins into the bile, into the gut to be excreted through the stool. If your bile flow is really thick and it's not happening, then where are the toxins going?
Interesting.
They can't go anywhere.
When you talk about bile and fiber, my brain goes to SIBO. So,
yeah.
So what's going on with the link between mold and SIBO? Because it is quite significant.
Yeah, so I think it's about 80 or 90% of people with mold illness will have SIBO. Interesting thing about SIBO is you might see clinically, you do a SIBO protocol, you do the retest and it's cleared, but the symptoms are still there.
Yeah.
That's a sign of mold.
Yeah.
So SIBO can be caused by mold, basically just in all of the risk factors that can occur with anyone with mold, things like slow motility, because the nervous system is very much affected, and as we know, when the body's under stress, we don't digest well, so all of the function towards the gut is kind of switched off. So you're looking at like slow transit time, low stomach acid, just general inflammation in the gut, which will happen because there's going to be inflammation everywhere. Dysbiosis that starts to happen because of the mold exposure. The beneficial bacteria numbers start to decrease. And very interestingly, mold actually has the ability to take our commensals, our good bacteria, and they can start acting in a pathogenic way, releasing toxins because of the environment that's going on in the gut with potential mold and fungus growing in there. There's this huge like turf war that starts to happen. And so that can happen. So you might even have these good guys and they're not acting in a very good way. They're acting more pathogenic, which is, yeah, a bit scary. And then, the sluggish liver and the thick bile flow, all of the risk factors for SIBO quite often are driven by the dysfunction that's caused from the mold. And then, of course, lots of antibiotics. People often get, if they go to the doctor first, tend to go down the antibiotic route for infections and things like that. So they've had lots of infections. So yeah, there's a whole host of things that will contribute to SIBO because of the mold.
So guys, if you've had SIBO, if you keep getting it back, if you get rid of it and it keeps coming back, or you can't get rid of it, then mold is something that you really need to consider, because it is one of the main causes that is hidden. People don't know about it.
Yeah. No,
that's the thing. It's this hidden illness that people are unaware of, and it is so common.
Yeah, and you can have fungal overgrowth too. You can have SIFO, and it's not as common for the mold to colonize in the gut or in the nasal passage, but it can happen.
Okay.
So you can see, so some people will just be unwell because of the toxin load and the inflammation from that, and others will become unwell because they actually get a colonization of mold in the gut and fungus in the gut or in the nasal passage. And so if you're someone who doesn't maybe feel better when you go on holidays, and if mold is your problem, there's two reasons for that. One of them would be because you're just in another moldy environment, which used to happen to me. I'd go to my in-laws and I'd go to my mum's house and I never felt better until I realized that their mold problem was just as bad, if not worse than mine. Okay. And the other thing is you might have a nice little colony that you're taking with you on holidays that's in the nasal passage or in the gut that's wreaking havoc.
Okay. Yeah, interesting. So Mel, I want to touch on that Marcon's test. Can you explain to people what the Marcon's test is and why we look at that?
Yeah, so that's a test. So the Marcon's is to do with staph infection, but you can get a fungal infection as well. So they'll basically just swab your nose and see what grows, basically. And that's where that MSH comes in. So people who get that low MSH hormone, they lose the defense mechanisms in the sinuses to stop colonization of fungus and bacteria and viruses. So they might develop an overgrowth in the nasal passage. So again, I don't necessarily always test that, but I have had a couple of people who've had a test. Some have had the staph, some have had actual fungus growing in there. But again, if you're in a moldy environment, you're breathing that stuff in your nose, whether or not you've got a colonization happening, you've certainly got a lot of exposure. You know, it comes in through the nose and through the mouth and into the lungs.
The key is you've got to get out, you've got to get away from the mold.
Yeah.
I get that. So Mel, just going back to treating mold and these detoxification pathways you're talking about, what do you use to support these pathways? Glucuronidation, sulfation, methylation, etc.
Okay, so I always use sulfur. So sulfur-rich vegetables, if you can tolerate them. So some people do develop a sulfur intolerance because as the sulfur becomes low, the body upregulates the sulfur-producing bacteria. It's actually like a defense mechanism. The body's trying to create more sulfur because you're wasting it into your urine.
Fascinating. It's trying to make glutathione, isn't it? Really, it's really needed.
Yeah, it is. It's trying to produce more sulfur. So sulfur foods, if you can tolerate them, always really important. I love Epsom salt baths because that's got the sulfur in it. I can support it that way. Glucuronidation, often we do calcium deglucarate because it helps with that enzyme. So because it doesn't matter how well glucuronidation is working, if that enzyme is high, it's just recycling everything. So you've got to stop the recycling and the reabsorption happening. So we often use that. But then again, a lot of the like the cruciferous vegetables as well is good for that pathway. And I love using sulforaphane. It's a really beneficial product for detoxification and providing what the body needs to help with the detox process. And some people might need some glutathione.
Yeah.
But it's a bit of an individual basis. But yeah, sulfur is
very important. So when you have an Epsom salt bath, guys, it's sulfate, which is the active form of sulfur, isn't it? So often people, when you're trying to consume sulfur through the gut, if you've got too much sulfur producing bacteria, you can feel nauseous and unwell from consuming sulfur. Whereas when you have Epsom salt baths, it provides the end product, doesn't it? It goes straight into the bloodstream.
Straight into the blood, yeah. But people can still react to Epsom salt baths as well.
Yeah, that's
true.
So
I always say there's a fine line between having an Epsom salt bath and feeling relaxed and feeling fatigued. So if you get out and you feel a bit woozy, then it's been too much. And a lot of that's just to do with when you're really blocked up and you're really deficient in sulfur, a little bit goes a long way. So it can start pushing the pathways too quickly. So you can react to that. The other symptom you might have is when you wake up the next morning, if you feel very groggy or hungover, that can be a sign that you're having a little bit of a problem with the sulfur and you might just need to reduce the dose. Like some people come to me and say, oh, I'm only having 2 cups in a bath. I've got patients who can only tolerate 1 tablespoon.
Wow.
So 2 cups for some people isn't much, but for others it can be. And you just have to build it up slowly. So yeah, if you always feel really tired after an Epsom salt bath and you think, oh, I'm just detoxing, it's just a little bit too much and I'd go a little bit slower.
Is that a red flag for someone for massive detoxification problems if they can't tolerate say a 1 cup Epsom salt bath that people often just do for relaxation?
Yeah, so if it could be a sulfur issue, it could just be general detox because it is pushing detox. But yeah, I think the main thing is there's a lot of messages out there to just push through the detox. It's just a detox, but we deal with people that are so much sicker than that, you know, maybe the average person can push through a little bit of detox, but the people that come to see us are normally like, I take herbs and I feel 10 times worse. And in time, push through. You're dealing with a very depleted body, a body that's under enormous stress, and it just doesn't have the resilience to deal with it. So you have to go slowly.
Interesting. So Mel, just so people can sort of get a bit of a takeaway, if they know that they've got mold in their house, they can't move at the moment, right? They're in a lease, they own property, they've got children, it's all a bit too hard. What is some ways that people can safely clean mold in their house?
Okay, so I guess the main thing is you can't clean mold, you have to remove mold. So before you remove mold though, where's the moisture coming from? Because you can remove the mold and if the moisture is still coming, the mold will keep growing. So if that is that you live in a really humid environment, one thing I probably should have mentioned with regards to where you find mold, people might find it growing in their wardrobe because you don't have very good ventilation in there often, especially if you've got a lot of clothes and they're all kind of packed in. You might notice mold growing on, like, especially like leather or suede, any natural fibers. So if you've got a lot of humidity, like when it was raining earlier in the year, we have dehumidifiers in our home, and we were pulling about 12 to 15 litres of water per day out of the air in our house.
It was crazy rain.
Yeah, it was crazy rain, and like lots of people started getting mold growing, and that's not necessarily you having a mold problem. It was ridiculous humidity. Like I think it was like 97% at some point. We do monitor our humidity quite closely, so that's how I knew. But like we had people going, oh, you've added water to that, and we're like, no, it's literally pulled that out of the air. So over the summer it can get pretty humid. You can get humidity up to like 70 to 80%, and anything over 55 to 60% is going to allow mold to grow. So if it's simply a humidity issue, then get a dehumidifier in to remove the moisture from the air, and you can, you know, use them from room to room if you want, or have them in each room. So there's that. Having good ventilation, open up the windows. One misconception though is when it's humid outside and the humidity is building up, that you open your windows, but that's just going to allow the humidity in. So if you've got an existing mold problem, you really want to keep the humidity down to discourage any further growth. So you'd close the windows, and that's when you'd run your dehumidifier. If you've got some sort of a leak, got to get it fixed. If there's water coming in somewhere, you've just got to figure out where the water's coming from and stop it. And then it's a case of removing the affected mold material. So if it's in gyprock, unfortunately, mold is so incredibly tiny, you'll never be able to clean it correctly. And even dead mold can still release the toxins. So you would need to replace the gyprock. For example, clothes you can clean because you are actually removing the mold out of the fibers. So you can, like when we moved out of mold, we soaked all of our clothes in borax and put them through the washing machine on a high temperature. And some of our clothes we did have to wash quite a few times. Anything that has visible mold, you probably just have to discard, especially things like leather. Like I had mold growing on a leather jacket, and there's just no saving it because it's a natural fiber. Yeah, the mold was feeding on it, and there's just
mold will grow on natural fibers, more silk. Cotton.
Yeah, because it's a fuel source.
Wool,
so you know,
cashmere as well.
Yeah, wool, leather, silk, a lot of those. So, but it just depends also on how thick the fabric is. If you can be assured that you can get it all out. But you know, things like pillows.
You can smell it though, can't you? It has that smell.
Yeah. Yes, you can. Well, some people can, some people can't. So some people with mold issues will have like a super strong sense of mold, and other people will lose the ability to be able to smell it at all.
Oh, interesting.
So I have quite the astute mold nose now. I remember we walked into like a bowling club with my in-laws, and I said to my husband, "There's mold here." And he said, "What are you talking about?" We walked 50 meters, there was a hole in the ceiling and a bucket underneath. And I was like, told you. And so I can smell it now.
Yeah.
So, but yeah, and another easy way to know is like if you go on holidays or away for the weekend and your house is closed up, if you come home and you can smell mold, there's mold. And then you need to find it. Yeah. Which is sometimes easier said than done. So yeah, removing the moisture, the water, and then just cleaning up the environment as much as you can. Unfortunately, because mold is so microscopic, you can't always see it. By the time you see the mold growing, that's quite significant growth. So yeah, it can be a bit tricky sometimes, but there are signs to look out for. And if people follow on Instagram, we've put a lot of information there about how to look for mold, and you know, talking about a lot of what we talked about today. We've got some information if you want to look at that.
So guys, Mel has kindly written all the posts on my Instagram page on mold. She's a wealth of knowledge about it, and that's why I've got her working with me, because I don't know much about mold illness, but I can pick it up really quickly in clinic from signs and symptoms. And I've never been wrong, have I, Mel? I send them through to her, and lo and behold, they have mold illness. So there's lots of information on my Instagram page, and if you'd like to check out the oxalate video, you can do so on YouTube. But Mel, you are an absolute wealth of knowledge. It's a pleasure working with you. So thank you so much for your time today.
No problem. Thanks for having me.
That's okay. Thanks.